Hey everyone, and welcome to today's Explainer. We've got a seriously fascinating, kind of a hybrid journey ahead of us. First, we're going to decode a complex, honestly terrifying disease that affects millions of people worldwide. And then, we're going to pivot. We'll look at exactly how modern doctors and healthcare professionals are using digital tools to teach patients about it. It's a great one, so let's just dive right in.
Here is our quick roadmap. We'll kick things off with the heart failure crisis, look at the actual mechanics of a failing heart, and recognize the warning signs. From there, we'll transition into the digital medicine prescription, the nuts and bolts of creating health content, and finally, the massive impact this has beyond the clinic walls.
All right, part 1, the heart failure crisis, understanding a complex diagnosis. We have to begin with a reality that is just terrifying for patients, sitting in a clinic and hearing the words, "Your heart is failing." Now, the absolutely crucial point here is that congestive heart failure isn't really a standalone disease. It's a consequence. It's the progressive result of underlying conditions. Think prior heart attacks, high blood pressure, or coronary artery disease. When the heart can't pump efficiently, your kidneys sense that reduced blood flow and, well, they kind of panic. They try to compensate by hoarding water and salt. That leads to congestion and swelling, which just puts even more strain on a pump that is already struggling to keep up.
Which brings us to part 2, mechanics of a failing heart, how the pump breaks down.
Let's look at what's actually happening inside the heart muscle to cause this systemic crisis. Mechanically speaking, there are two main ways this pump fails. It either becomes way too weak or becomes way too stiff. In systolic heart failure, the muscle weakens, maybe from a past heart attack, and it literally just cannot squeeze hard enough to push the blood out. But in diastolic heart failure, the muscle might actually grow thicker to try and fight against high blood pressure. The result? It gets rigid. It can't relax, it can't stretch, which means it can't fill properly with blood before the next beat.
What's truly fascinating here is how the two sides of the heart directly mess with each other. If the left side fails, blood backs up into the lungs, causing a sort of fluid traffic jam called pulmonary edema. And here's the wild part. That increased pressure in the lungs makes it incredibly hard for the right ventricle to do its job. Because of this, left-sided failure is actually the most common cause of right-sided failure. That's what results in blood backing up into the systemic circulation, causing that swelling you see in the legs, feet, and abdomen.
Now, to actually measure how effectively the heart is pumping, doctors rely on something called the ejection fraction. To put this into perspective, according to the Mayo Clinic, a normal, healthy left ventricle doesn't empty entirely with each beat. It pumps out roughly 50 to 70% of its filled volume. That's our baseline.
But when things go wrong, like in reduced systolic function, that ejection fraction drops dramatically. We're talking below 40%. If we zoom all the way down to a microscopic level, the heart's fundamental engine, the sarcomere, becomes totally impaired. The vital proteins inside literally lose their synchronized grip on one another, and that results in a weak, diminished contraction.
Moving on to part 3, recognizing the warning signs, what patients experience. So how do those microscopic protein failures actually feel to the person experiencing them? The American Heart Association outlines these stark warning signs, and it all comes back to how sluggish the blood flow is. Basically, the body goes into triage mode. It diverts vital oxygen and resources away from the stomach and the brain just to prioritize the core organs. This is exactly why patients don't just experience shortness of breath and swollen legs, they're hit with profound fatigue, nausea, and even confusion or memory loss. The brain literally isn't getting what it needs.
And this brings us to a huge pivot in our explainer. Imagine you're the patient. You're exhausted. Your legs are swollen, your memory is foggy, and a doctor just bombarded you with terms like systolic dysfunction and ejection fraction. Where do you turn when you get home to decode it all? You go online.
Which leads perfectly into part 4, the digital medicine prescription. Doctors turning to YouTube.
Healthcare professionals are realizing that the standard 15-minute clinical visit just isn't enough anymore, so they're stepping up to combat misinformation online. Creating a digital explainer might sound super intimidating to a doctor, but as clinical creator Dr. Eve points out, the process perfectly mirrors the clinical journey they already do every single day. You start with discovery, taking a history of what your audience needs. You evaluate the landscape, just like examining a patient. You plan a strategy, that's your diagnosis. You implement by filming the intervention, and you reevaluate based on patient engagement. It is literally the scientific method applied to digital education. And a crucial point here, you absolutely do not need Hollywood-level equipment for this. A simple smartphone camera with 1080p resolution is more than enough to get started. Honestly, good, clear audio from a basic clip-on mic is far more important than a fancy 4K lens. Think about it. Patients are looking for your expert knowledge to save their lives. They don't care about cinematic perfection. They just want stability, clarity, and authority.
All right, part 5, creating health content. Best practices for patient literacy. Having the right gear is great, but how do you effectively script this life-saving information? Notice how just a few simple communication tweaks can dramatically improve a patient's understanding. For instance, drop the confusing percentages when explaining risk. Instead of saying 2%, say 2 in 100 people. It's so much more concrete. Drop the dense medical jargon. You can even use tools like the Hemingway app to check the readability score of your script. Remember, you're making this accessible to someone who is actively unwell and cognitively fatigued. Keep it plain, simple, and clear.
To ensure absolute trust, creators are strongly encouraged to follow established frameworks like the PIF-TIC standards highlighted by Pharmacistic Virginia. What does that mean? It means aggressively citing your references in your description. It means being completely transparent when medical evidence is limited. And critically, it means committing to reviewing and updating your content every 3 years so your patients are never acting on outdated clinical data.
Beyond the script itself, your actual on-camera presence is massive for establishing trust. It's recommended to shoot horizontal video to really dive deep into the nuance of a topic, rather than rushing through it in some short vertical clip. Dress professionally. Wear your badge. Speak directly into the camera lens. By doing this, you're replicating the feeling of the patient sitting right across from you in the clinic. That builds profound trust.
Finally, part 6, impact beyond the clinic. Scaling patient care globally.
Why is this fusion of medicine and digital content so incredibly vital right now? Well, digital platforms like YouTube offer an unprecedented scale for patient care. We're talking features like automatic audio dubbing into multiple languages, which instantly breaks down communication barriers. These videos can be viewed on low-data mobile plans, reaching folks in lower socioeconomic areas. Plus, in certain regions, platforms now award a licensed healthcare professional tag to verified creators. This ensures patients know they're getting safe, evidence-based care amidst the absolute sea of internet noise.
As Dr. Eve noted, this whole endeavor isn't about becoming some viral influencer. Not at all. It is a profound digital extension of a healthcare worker's clinical duty. When a terrified patient gets home with a heart failure diagnosis, finding a well-crafted, clear, and compassionate explainer waiting for them online, well, that can literally save their life. So I'll leave you with this provocative thought to ponder. If a simple, well-crafted explainer can decode something as complex and terrifying as the failing mechanics of a human heart, what other massive medical mysteries could we solve together to empower patients worldwide? Think about the impact we could have just by turning on a camera and sharing what we know. Thanks so much for joining me on this explainer, and keep learning.